I invite the first speaker, Dr. Anupam Singh, Senior Resident in RIO Sitapur Eye Hospital, Sitapur, and his topic is comparison of optical coherence tomography, angiography, and fundus fluorescent angiography in patients with diabetic maculopathy.
Good morning, everyone. Today, I'm going to present my thesis that is a comparison of the optical coherence tomography angiography and the fundus fluorescent angiography in the patient with a diabetic maculopathy. I have no financial interest in this presentation. As we all know that diabetes is a going worldwide epidemic, and in the India, the prevalence of the diabetic macular edema among the people with the diabetic is reported to be 8.9%. And we all know that although the fundus fluorescent angiography is a gold standard and used to assess the leakage in the vascular bed qualitatively in the macular edema patients, but it cannot be used repeatedly due to the toxic nature of dye and various side effects. Whereas the Sweatstone OCT-A is a newer technique which can acquire an image of the retinal vasculature without the need of any toxic or invasive procedure. The aim of my thesis was to assess the effectivity of OCT-A when compared to FFA to detect the various structural features in the patient with a diabetic maculopathy. The research hypothesis was that the OCT-A is a comparable substitute to FFA for the analysis of the retinal vascular pathology in the diabetic maculopathy. The objectives of the study were to compare the ability of OCT-A with FFA to evaluate the following structural damage. That is the FAZ zone diameter, FAZ distortion, number of microaneurysms, number of neovascularizations, number of CNP areas, and number of edemas. Coming to the material and method, the study was conducted in the retina department of the Regional Institute of Ophthalmology, Sitapur, with a duration of 2 years. It was the cross-sectional agreement study of the 2 diagnostic tests with a sample size of 102 eyes. The patient who were above the age of 18 years and presented with a diabetic maculopathy were included in the study. Coming to the exclusion criteria, the patients which were not willing to participate in the study and having the significant media opacities like the cataract and vitreous image were excluded from the studies. For the image acquisition, for OCT-A, we use Top Gun DRI OCT1 Atlantic Source OCT, and for FFA, we use Visucam 500 machine, which is from the Carl-Zeiss Optics. To quantify the area under the consideration, we use the Java-based images software. These are the images which are subsequently taken for the study. Now, starting with the result, the best corrected visual acuity in the right eye at the presentation was a 0.84 with a standard deviation of 0.82, and in the left eye it was 0.91 with a standard deviation of 0.91. When compared in between the FFA and OCT-A, we find that there was 0.8% difference in the measurement of the horizontal diameter of the FAZ, whereas the 2.16% difference in the measurement of the FAZ diameter area of the FAZ when compared on the FFA and OCT-A. When Pearson correlation coefficient were applied on these data, we found that there was very strong to perfect agreement in between the horizontal diameter and the area when compared on the OCT-A and FFA. For the microaneurysm, we found that the FFA was better. For the neovascularization, we see that it has been seen that the agreement was observed for the 96 eyes with the kappa coefficient value of 0.90, which shows almost perfect agreement. Almost perfect agreement was also seen for the number of capillary non-perfusion areas, and for the edemas, agreement was observed in the 88 eyes with the kappa coefficient value of 0.663, which showed the substantial agreement. Now, coming to the discussion, we found that the horizontal FAZ diameter and FAZ area was showing very strong correlation when compared on FFA and OCT-A. For the CNP, the agreement between the FFA and OCT-A was found to be almost perfect. To assess the burden of the exudation, one need to study the leakage, which can be studied only on the FFA. The limitations of our study was the low sample size, and our OCT-A imaging was confined to the posterior pole, so we were not able to assess the peripheral vascular changes. To conclude, the SS-OCT-A is a reliable, non-invasive and reproducible imaging technique as compared to FFA. And the fovea avascular zone details study on OCT-A shows very strong agreement with the FFA, where the horizontal diameter shows much stronger agreement. These are my references. Thank you.
Thank you, Dr. Anupam. You have done OCT-A and FFA in all the 1 or 2 cases, right?
Yes, sir.
So which one was done first? OCT-A was
done first, okay. And after that we went for the full threshold FFA, sir.
So you didn't first identify the neovascularization, and in that area you did do the
yes,
OCT. Sir. Okay, but you mentioned what was the subclassification? How many were PDRs? How many had macular problem? How many cases had a macular ischemia?
Sir, we taken the all patients with the diabetic maculopathy only, sir, whether it is NPDR, macular ischemia, or the PDR, sir. We did not subclassify, sir.
No, no, because if you are comparing the identification of neovascularization, you should know how many are PDR, so that the PDR identified by OCT and PDR identified by FFA. Because if the, what do you call, the...
Sir, the maximum patient we took was the PDR, but sir, this criteria was not included in the study, sir.
Okay, so how many cases had macular ischemia?
Sir, we have seen that around 92 to 93 cases, sir, having the macular ischemia, sir. But sir, we were not included that in the studies, sir.
Okay, so any...
What is your conclusion?
Sir, OCT is a reproducible technique when compared to FFA, sir. So for the subsequent visit, we cannot do FFA to see the progression of the disease or to see the extent of the treatment that the patient is recovering or not. So we can do the OCT-A and we can see that, sir.
Which procedure is better?
Yes, sir.
So that is the question.
FFA is better, sir. FFA is the gold standard issue, sir.
Okay, thank you, Dr. Anupam.